Hi, everyone. My name is LaDonna Fuller, and today I want to talk to you guys about sexually transmitted infection, known as STIs. Sexually transmitted infections are a major public health issue, impacting millions globally. Women may face unique symptoms and health effects from these infections. Knowing the type of symptoms, prevention, and treatment options for STIs are essential for maintaining sexual health and avoiding long term complications. Sexually transmitted infections are caused by bacterial viruses, parasites, and fungus spread through the vagina, anal, or through oral sex. Common STIs include chlamydia, gonorrhea, HPV, herpes, HIV, and AIDS. These infections can really affect women's health differently and often show subtle or no symptoms, making regular screening and early detection critical. So, what are some symptoms to watch out for sexually transmitted infections? Pelvic pain, heavy bleeding between cycles, yellow and green vagina discharge with odor, itching, discomfort during intercourse and urination. If untreated, it can cause serious health problems affecting the heart and the nervous system. Some strains of HPV can cause genital warts, others can lead to cervical cancer. Regular pap smear and HPV testing are important for early detection. So, what are some treatments for STIs? For bacterial STIs, usually treatment consists of an antibiotic, taking a pill. For viral STIs, managed they are managed with antiviral medication. So, what are some prevention methods that we can do as women so we won't have to deal with STIs? One prevention method is use condoms. Using condoms reduce the risk of most STIs. Getting regular screening for early detection and treatment such as HPV. Also, being getting vaccinated. Being vaccinated against HPV will help. Also, educating yourself, understanding the risks and preventative measures that can help reduce STIs. So it's very important that we take our health serious as women. We want to make sure that we take the necessary steps to protect ourselves by using condoms, going to get checked up. If we're having symptoms, make sure to go see your doctor, right? Early detection is the key. It will save your life. Thank you.
Hello, everyone. My name is Faith Nodi. Um, I'm gonna go off and piggyback off of LaDonna about STIs. I think what really demonstrates or explains STIs are that they are common, many are curable, and all are preventable, as said by the CDC. What's important to note is that the CDC states that STDs develop as a result of STIs. So, a sexually transmitted disease implies that the infection has led to some symptom of the disease. When we talk about STIs in women, just like I said, like going off of what LaDonna said, women are disproportionately affected by STIs and they have more debilitating effects than men. What many people do not know is that STIs in women can have lifelong impact on a woman's reproductive system, such as infertility, chronic pelvic pain, genital ulcer disease, pelvic inflammatory disease, PID, vaginitis, and many more harmful effects. And the reason that women are more affected is because of the female anatomy. STIs affect the genital and the extragenital sites. Now, the anatomy reason behind as to why women are more affected is due to the vaginal mucosa. It is very thin and is easily penetrable by infectious agents, bacteria and stuff like that. And according to the American Urological Association, some STIs can spread into a woman's uterus and fallopian tubes. They can cause PID, and it can also cause infertility and ectopic pregnancy, which can lead to fetal death and possibly the woman carrying to death. STIs can also be passed from mother to baby. There's also some links between STIs and cancer. So here I provided a picture just of some of the STIs and how they look in the female reproductive system and anatomy. Going on, STIs in men. There are some risk factors for men, which are usually gay or bisexual men that are sexually active. The CDC recommends that men get tested for HIV once a year, syphilis, Hep B, C if symptoms are present, chlamydia, gonorrhea of the rectum if they have had anal sex within the year, and gonorrhea of the throat if having performed oral sex. MSM, sexual intercourse, have higher risk of syphilis and make up more than half of all new HIV infections. Like stated before, there are often no symptoms of STIs, but men may experience burning or itching in the penis, a drip discharge from the penis, pain around the pelvis, sores, bumps, or blisters on penis, anus, or mouth, burning and pain with urine or with bowel movements, having to go to the bathroom often. Here I provided another diagram of the men's reproductive system and how that works. Prevention is about the same for men as it is for women in regards to STIs that LaDonna talked about earlier, using condoms, limiting the amount of partners, and using clean needles if injecting drugs. Treatment is about the same medicine, antibiotics, the HPV vaccine. Even though that's not a treatment, it is a good prevention. This is references for me and LaDonna. And next we will go with Marcus, who will talk about 2 of the most common STIs and statistics with those. Thank you.
So thank you for having me. So my slide consists of a couple STI infections that I took the opportunity of looking up. One of them is AIDS. In 2023, there were 39.9 million, 36.1 million to 44.6 million people living with HIV. Most of these people don't really know that they have contracted HIV. 38.6 million adults and 15 years or older. 1.4 million children, 0 to 14 years. 53% of people living with HIV were women and girls. 86%, 69 to 98% of all people living with HIV knew their HIV status in 2023. About 5.4 million people did not know that they were living with HIV in 2023. Since 2010, new HIV infections have declined by 39%, which is a good statistic rate, from 2.1 million to 1.3 million in 2023. However, this falls far short of the target of getting below 370,000 by 2025. Also, that target has been lowered in 2025 to attempt to get to 250,000. Hopefully, we will reach that number and the signs of HIV will lower. for the first time in a long time. The next slide I want to speak on was chlamydia. In 2022, a total of 1,649,716 cases of chlamydia trachomatis infection were reported, making it the most common nationally notifiable sexual transmitted infection in the United States for that year. The rate of reported chlamydia in 2022 was similar to the rate in 2021. It was 495,000 per, 495 people per 100,000. And you just took off 5% rate from the 2022 to 2021 year. Now, people don't realize that chlamydia infections are often asymptomatic, but common symptoms can include unusual urethral and vaginal discharge. If left unthreatened, chlamydia infection can lead to serious health problems, including infertility in women, and it also can increase the risk of HIV infections. So in Texas, chlamydia is number 16. We're number 16 on the CDC chart, one of the highest numbers in the United States. But as you look over at the other rate chart, the 600,000 women unknowingly have chlamydia from 2013 to 2022. The total is 400,000 mark, and men only range between 200,000 to 400,000. As you can see, the dark green area, the dark bluish green area means that the chlamydia rate is actually higher in the cases per 100,000 people. I have also included, if you want to know more information, I've included references from where I've got this information from. Thank you for having me.